Good evening. Thank you for being with us. This is our weekly current affairs program in English on a Friday night, live from Net TV studios. I'm Leah Hogg. My first guest today is a physician who has a very unique approach to medicine. I am with Dr. Shelia Jin, and I thank you very much for joining us and coming here.
Thank you for having me.
I'd like to speak about your childhood, and if you could take us back to Shanghai, where you spent most of your childhood. Did you decide to study medicine at an early age?
Well, unfortunately, no, not really. Because when I was growing up in China, those days were 1960s, political situation in China was different. There was Cultural Revolution, all this. So my parents, they wanted me to study science. So I always wanted to be a writer. I love reading, I love history, I love geography, I love philosophy. So when I graduated from high school, when the university was reopened after Cultural Revolution, my parents decided you have to study medicine, because medicine you can work anywhere, you can save life. It will be with you forever, always useful, can help other people. So it was against my wish. I want to be a writer. So, but my teachers at school, they convinced me also. They tried to tell me the best writers in China, most famous writers in China, they were all doctors. They all studied medicine. Like a father of China, Republic of China, the first president of China, Dr. Sun Yat-sen, the best writer in China, Lu Xun, they're all doctors.
Yes.
So he said, you can always study medicine, then you can, as a hobby, you can write.
And do you write?
I used to. Now I don't have time.
Yes.
I haven't had time.
You're very busy.
Yes,
You graduated in both Western medicine and Chinese traditional medicine.
Yes.
Was that a choice you made at an early age?
Not really, because in China, in my days, now I think it's different. In my days, medicine, Chinese medical school, it's compulsory. You have to study both Western medicine and Chinese medicine. So when we choose to specialize in acupuncture, for example, as after graduation, you can choose to be a, say, gynecologist, a physician, or surgeon. I chose to be acupuncture specialist.
Right.
But then afterwards, in 1980s, I decided to go abroad to study more. So
and you went to the United Kingdom,
I went to
didn't
UK,
you?
yes.
What was your experience living there, studying and working there too?
Even though I love Shanghai, I love China, but I love London. I love the London life. I love UK and also London University, King's College. It's one of the best universities in the world, in medicine especially. I did some research before I applied, because they invented penicillin, for example, in the UK. So I applied, I was fortunately accepted, and I enjoyed the London life. I still love London.
Yes, I mean,
Yes.
I think it's unique also.
Yes, the culture, you know, the theatre, and all the medical research facilities, all the universities, university life. It's wonderful.
I mean, there's a lot of opportunity in London,
Yes,
I
and the
think.
museums.
But you
And I love British life.
Yes, you
They
eventually came to Malta.
Yes, they are understated.
Yes, yes.
Yes.
You eventually came to Malta. What do you enjoy about family life here?
I love Maltese way of family life. Families are very, very close. And I came to Malta for holiday many moons ago when I was still working in London. And I fell in love with Malta. That's decades ago, many decades ago. Maltese people are very, very kind, very generous. Malta was so peaceful and quiet. And those days, still lots of green trees, you know, country life. But most important for me, I think, impression I had was Maltese people. Very,
It's
very
lovely.
kind.
It's
yes.
lovely of you to say
Yes.
that. Lovely. You're practicing acupuncture here. What is the benefit of combining Chinese medicine and the traditional Western medicine as we know it?
I think Chinese medicine pays a lot of attention on prevention, but also treats patients from a holistic point of view. Western medicine, many times we treat the symptoms or even through underlying causes, yes, but Chinese medicine, mainly underlying causes and prevention. So if you have a headache, you don't just treat headache, you have to find out why, how not to let that happen again. You have pain, you have, hormonal problems, why. Underlying causes are very important to find out and treat the patients as a whole.
Mm-hmm. Do you start the combination of the two different principles in medicine on children also?
Yes, I think for children, treating children with Chinese medicine actually is very beneficial because I try not to abuse antibiotics because I think in the West, antibiotics, medications really in a large scale abused, overused. So for children, for them to be healthy, to grow up in a healthy way, it's important to be naturally healthy from holistic point of view, nutrition, and trying not to forcefully using medical intervention.
So more of a holistic approach,
Yes,
and a combination with what we traditionally know.
However, Western medicine's made a big progress, so it's important. And I always emphasize with my patients, their first point of call is their family doctor. And I think Malta, we are very, very lucky. We have very good systems, and we have many good family doctors.
Yes, and you are one yourself.
Yes, I used to work as a family doctor, but I think now I'm more concentrated on acupuncture because we have so many good family doctors.
Yes.
I always refer my patient back to their doctors.
Yes.
But so you have communication with them.
And you stick to your certain speciality.
Yes, that's right.
Can I take a few minutes to speak about the different theories about the outbreak of the novel coronavirus and the disaster it's caused in an economic way all around the world? What are your views about that?
Well, there's a lot of conspiracy theories. I think I can't really in a position to speculate, and it's not really ethical. Although I kept contact with my colleagues in China, lots of public health officials and professionals, but still there's a lot of work to be done. So we can't really make any conclusions. Although science, there's no borders. I think all the scientists, the medical doctors should work together.
Mm-hmm. I mean, there are no clear answers yet to this virus. Do you see a way where scientists and governments all around the world could work more closely together to find a way in which we could live with this virus?
Definitely. I don't think we need to panic. And this virus is going to be with us for a long, long time. But the potency will change, it will mutate. But I think science will make lots of progress, for sure. So.
Focusing on Malta and the strict management of COVID-19 right at the very beginning, at the outbreak, proved to be a huge success, and we came down to zero at one point. However, very lately, we've seen an alarming increase on a daily basis of positive cases. What are your views about that? How can it be prevented? Can it be prevented?
Of course. I think public health is science. I think we just need to follow scientific data. It's a very data-driven, and we need to let professionals do their work. Politics and the medicine, they don't mix. So if we follow health professionals, we have very capable health minister, we have very good public health officials, professionals. When they do their work properly, let them freely and transparently, Malta can do great.
Although we are seeing more cases, the number of severe cases seems to have reduced. Why do you think that is?
I think basically Maltese or older generation or vulnerable population are very self-disciplined. We can say I'm very impressed. Lots of people self-isolation. 3 months, lots of people make huge sacrifice. They didn't go out, didn't mix, no socializing, and that makes a big difference. If we are disciplined, we hand washing, wear masks, keep distance, we'll be fine. No mass gathering.
Yes, I think that's quite important.
That's a big
also.
important issue.
As a mother yourself and a physician, what are your thoughts about children and their education? I mean, a lot of children have suffered through lockdown due to the lack of them going to school. It's very difficult for kids to focus, especially the very young ones, on having virtual lessons. Do you think they should go back to school in September?
It's not a simple yes or no. It's a very delicate balance issue. As a mother, I think our children's health, safety are imperative. But in the same time, teachers' health and safety also. And I have huge respect for our educators. They're doing a very, very difficult job. I think we need to find a very fine balance. When there are cases, children can go back to school when they're old enough, disciplined enough to be social distancing, yes, by all means. But when it's not realistic, online learning, it's important.
How realistic is it to teach very young children? I'm speaking about children from the age of 3 to 6 to maintain social distancing.
I don't think it's realistic to expect young children to go back to school to maintain social distancing.
So what happens in
We need
September?
to keep a balance, I think. We need to keep a balance. If classroom can be put the desks far apart, if they can more hygiene education, public health education, it's a good start.
But these kids all go back and many are cared for by their grandmothers in Malta.
It's not realistic because what if one doesn't have a healthy grandparent to look after their children? What are you going to do?
So I mean, from the way I'm seeing your views, you're saying that we've got to sort of be cautious.
Be cautious, but find a balance both ways. We cannot close school forever because education being interrupted is not healthy. And also for mental health for children is not right.
And can I sort of ask you, are you still in touch with your family in China?
Yes.
Yes.
My family, my parents are in Shanghai. They're over 80s. They're very healthy. China, I think we have very good public health system. So contact tracing and prevention all in place. I think in Wuhan, when epicenter, when it started, they have issues regarding transparency, regarding, immediate effective treatment or let people know. There's lots of things to be done,
Yes.
have done better.
Yes.
But in Shanghai, I think we're very, very good.
It's
So
been
they're
a
very
learning
healthy.
process, I think, for everyone.
Yes. At the beginning, we didn't know much, but now I think most of cases are being more transparent. Government, management improved a lot.
In a nutshell, to close today, and I hope you'll come with us again soon, how can we describe acupuncture and the benefits that a patient can reap from having acupuncture as an addition to Western medicine?
Acupuncture can treat many conditions according to World Health Organization, but also in the same time, it's very good maintain health, prevention, keeping balance. So
you've got to try it.
Yes. So many of my patients come to keep well-being, basically.
Do you feel the effects straight away from a first session?
Most of them, yes.
Yes.
To a certain degree.
Yes. And it's also a matter of positive thinking.
Not necessarily, no, because acupuncture can be worked on animals, on babies. They don't have psychological prejudice.
Sure. Thank you very much, Dr. Jin. Thank you.